Today we're going to talk about specific points about partial coverage crowns. Okay, so we know that we have teeth that sometimes have restorations, sometimes they have many caries, sometimes they have caries in multiple positions of the tooth, but the rest of the tooth is sound. Okay, it could be the labial surface, it could be the lingual surface, it could, buccal surface, the lingual surface, it could be the proximal surface with a good occlusal contact with the upper on this side and a good contact with adjacent tooth on the other side. So why destroy these surfaces? These surfaces are sound, these surfaces are keeping the occlusion, keeping the contact with the other teeth. So why destroy these extra these teeth, good tooth structure? Why do we need to destroy them if we can do a partial coverage? But still the area here on these sides are weak. Maybe this restoration we have weakened this surface. Maybe this one is the weakened cusp. We don't know what other the options that we get once we clean the caries. The caries is a dynamic process. It's an irregular process. No patient is like the other. No tooth is like the other in terms of the caries attack. And with the caries attack, we will have weakened dental tissue that sometimes we have to strengthen them. We are looking at extracoronal restorations. Those restorations have a range. We have a range of extracoronal, not intracoronal. Intracoronal means inside or confined by the tooth structure. We have dentine and we have enough enamel to support whatever we're going to do intracoronally. We can put class 1, class 2, class 5, as long as we have enough tooth dentine and enamel to support it. But sometimes we don't have enough tooth dentine and enamel. We need to strengthen the tooth and confine everything inside. If we have a good core, we have extracoronal restorations. They extend from the minimal 1/2 coverage of the tooth, okay, half a crown, where we leave the proximal surface intact, up to the full crown, where all of the surfaces are covered. But taking into account half a crown up to the full crown, we have the 3/4 and we have the 7/8 crown. Okay, all of these we have a good core left. So even if I'm preparing part of the tooth, the rest of the tooth I have enough bulk of dentine and I have enough bulk of enamel to support the remaining tooth structure. I'm working on the partially destructed part. This is not totally destroyed. If it was destroyed and I'm reaching into the endo area where I'm treating the pulp, I'm doing endodontic treatment, there I'm going to change. It's no longer an extracoronal. Now I'm going for onlays and other procedures, okay? Endocrowns and that line of treatments. So I'm placing material to restore the core. But if my restoration, my caries was irregular, it left enough bulk of dentine, but it's so irregular I could not place a restoration in it. I need to cover it. I need to strengthen that part of the tooth that is covered. So I have enough dentine. This is where we go for partial coverage, not inlays, onlays, and endodontic crowns, okay, endocrown. Here we have enough. This tooth is vital, by the way. Usually this tooth is vital. The dentine on one part and the enamel is intact, and we have an irregular lesion that we could not confine inside a filling. I don't have enough enamel and dentine to support an intracoronal filling, but I have irregularities that could not be confined, so I need to cover this by a partial crown. Okay, so these crowns are the range. With less than half a crown, it's not partial coverage. It goes back to become a filling and a restoration. So half up to full crown. What are our indications for each one? It depends. The half crown usually is when we leave any partial coverage in definition in the glossary prosthodontic terminology is when I leave a part of the tooth sound. I'm not fully covering it. The crown is full coverage of the tooth. So half, I'm usually leaving the distal. Suppose I have a good contact, I have a good occlusal contact here, I have an adjacent tooth, also good contact, and the distractions happen here. Or I have a filling and I want to do a retainer for a bridge. I need to cover because I need this to retain my bridge and contact. Okay, so this is half of the tooth. So I usually do half. The half should be in the proximal.
Which is distal lingual.
We're talking about first half coverage is in molars only. Okay, why? Because this part of the tooth that I'm covering, half coverage, it has enough dentine and enamel to support it. But in premolars I could not use half.
Oh, it's very small.
No, it's very small. So this is only specific for molars. Okay,
يعني
half
زي
coverage.
الفينير يعني بس
It's like a veneer, but one
أكتر
side.
من
Yes, I'm taking, for example, I could crown this part and leave this part intact. Okay, it's not an onlay.
Like بال الكروم كوبلت ار بي دي لما نكون نستخدمه when we use the tooth as a abutment.
Yes, as an abutment. So I need sometimes
Proximal plane.
it's either because I have partial destruction and I told you I could not confine it. This, for the, let's say this example, and this is where the confusion occurs for many prosthodontists. They don't know what's the meaning of the restoration itself. For example, this is a regular okay, MO. Okay, I have enough dentine here, I have enough dentine here, I have enough enamel here, I have enough enamel here. I could simply place a filling. No need for something else, صح?
Yes.
But what if this filling buccolingually is a bit large and I have a chipped enamel? How can I restore this morphology? A filling will not be confined in the space. I need something extra to cover it. But this is totally sound. This half is totally sound. It's even more clear when we do it in the lowers. Okay? It's not an onlay. An onlay is when I cover cusps only. I'm covering cusp. But here I'm covering the cusp and the proximal surface. So this is the difference between an onlay and a partial coverage crown.
طب دكتورة هذا مش استاتيك بالمرة.
It might not be aesthetic unless I'm using aesthetic material.
But it's conservative very much.
ما ببين نص السن.
No. Usually, if when they do this work, they do it all with metal except an area they leave as a window where they place porcelain. It's the aesthetic angle. Do you know what's the aesthetic angle? Oh, what's the aesthetic angle? When we smile, this is our canine, okay? Going backwards, this is our canine. Going backwards, we only see part of the teeth, sir.
Yeah.
The teeth are
Okay.
put behind each other. Which is the angle? This is an excellent question because it will emphasize the concept of the aesthetic angle. When I'm looking from front to back on the teeth, what do I see? I see this angle. Which is this angle? This is the most demanding, aesthetic demanding angle. If I'm looking at the tooth, it is the mesio-buccal angle of the tooth. So this is a molar, for example, and say this is a lower molar, for example. This is the angle that will be showing when I'm smiling. All of this is hidden behind. You don't see it. So this is the concept of aesthetics, okay? They concentrate on this angle. The mesio-buccal is kept aesthetic. So how do they do it? They do the partial coverage in metal. They do it in metal, but here they leave a window in the metal where they place porcelain. And the preparation here on this angle is a shoulder preparation. Everything else is the chamfer preparation except this angle. Okay?
طب دكتورة لازم
Yes.
آخذ مثلا أكتر من نص البكل سيرفس عشان يكون.
Yes, it has to have more than half of the buccal because I need enough
ما يبين
structure.
الفرق.
No, it's not the issue of the aesthetics, it's the issue of the retention of the restoration. Because one of the problems with these restorations is its resistance form. We don't have the resistance form that we get from the full crown. Because in the full crown, I have a resistance laterally. So, because I'm circumferencing all of the tooth from all sides. So I have more than 180 degrees encirclement. The crown is encircling the tooth, so I have a good resistance. But here, I'm depending on something else for my resistance. Okay, so I'm here just discussing the glossary of partial coverage crowns. Okay, so half a crown works with molars only. Usually we use them when we have a good contact on one side. It could be the mesial or it could be the distal, depending. And I have maybe some distraction or I need as a retainer. Okay.
ويكون هذا بالفيتامين.
Vital teeth, yes. Usually in vital teeth. But if they are endodontically treated and have a good amalgam core or Nair core, it could be applied. Okay, because I don't have enough enamel while I have sound teeth. Okay, I could use it. 3/4 crown is when I'm covering, and usually in the glossary that's the buccal. So if I'm looking at the tooth from occlusally, suppose this is a lower tooth, and I have the buccal surface intact, but I have it, the dentine is intact, the enamel is intact, I have enough thickness dentine and enamel here, but here I have some destruction, the chipped. What am I going to do? I could cover all of this, and I have enough dentine core, the tooth is vital usually, and I cover all of this area. It's the 3/4 crown. Okay, 3/4 crowns apply for molars and premolars, because I could apply, and usually it's the facial that's intact, but the palatal has been destroyed or it's fractured, it's chipped away because of the caries, and I could encircle this area and leave this area intact. Okay, 7/8 crowns applies only to molars. So the 3/4 crowns is what applies for molars and premolars. This is for molars and this is only for molars. Once more, I have a destructed tooth. I'm looking now occlusally. Okay, suppose this cusp is intact, the dentine is intact, but all of this is destructed and chipped away. I have enough dentine core, okay, but this cusp and this angle is intact, so I could place a crown only on these sides, and because I only left one surface, we call it 7/8 crowns, okay, because of the numbers of surfaces I've restored. So the half crown applies for molars, the 7/8 crowns is molars, the 3/4 crowns applies to molars and premolars. Okay, so I hope now it's clear. Crowns applies for everybody, it's full coverage, but today we're not talking about crowns. We already did in the last task, so we're concentrating on these.
دكتور الماتيريال الحاجات اللي بنعمل فيها metal.
Okay, materials. If I'm going to talk about the materials,
Gold material.
okay, the most famous one is alloys. Okay, alloys, and they come in mixtures. Okay, the gold alloys are the most famous. Gold, okay, titanium, and ceramics. Now, what we don't have studies about is monolithic ceramics. These are still introduced recently, ceramic systems, and they are usually used for inlays, onlays, full coverage crowns. In the textbooks, you will not find monolithic ceramics as partial coverage crowns. But the good thing about these monolithic ceramics that you can use them. By the way, base alloys here, base alloys as PFM. Those used for PFM crowns. We also could use them partial coverage crowns, PFM. Okay, monolithic ceramics, you will not find them in textbooks because they're recent, and the good thing about them, they have the strength of close to the ceramics, not as regular ceramics, as zirconia ceramics. They have good strength beyond lithium disilicates. They have better strength than dilithium silicates, but still not as strong as ceramics. So this material is new in the field that you could be using for partial coverage. This is in terms of materials. Any other question? Okay, so we're again with our notes with the procedures. I hope this is now clear, and we're going to begin with the next step.